Our next speaker, Insoo Hyun, is Associate Professor of Bioethics and Philosophy at Case Western University and has been very active in this domain. Thank you.
Okay, it's great to be here. Thank you for the invitation. So I'm a philosopher by training. I'm not a scientist. So don't let me hold that against you in any way. So as for disclosures, so I am the Stem Cell Research Oversight Committee Chairperson for NICEF, New York Stem Cell Foundation, which was partly involved with the Dieter-Egli study in the mitochondrial transfer research. I did not review, our committee did not review that for escrow, but just to let you know, I'm the committee chairperson for that group. The other thing is, just as George mentioned, the International Society for Stem Cell Research is doing revisions on the guidelines, and I'm on that committee as well. Okay, so obviously for preclinical work, we have two types. We have animal studies and we have in vitro studies using human biomaterials. I'm not going to speak much on the animal study issue. I think we can all appreciate there are lots of really interesting lingering questions about the right species, the relevance of that species, how far out do you go, et cetera. Okay, so I'm going to leave that alone. I also think that there's a pretty good regulatory structure for animal research, at least in the U.S. with the IACUCs, and pretty clear standards for that. So that's not going to be too much of my concern today. I will now turn my attention to in vitro research using human biomaterials. As was already mentioned by the previous speakers, I think we can all appreciate that there are not at this point what I would just call, in quotes, clinical grade standards that are defined for micromanipulating eggs and embryos to be used in clinical trials research. There may be iatrogenic harm, so to speak, through the techniques, and so maybe a preclinical research program might involve things like just what happens when you micromanipulate the egg and not do the nuclear transfer, just put it in the pipette. We've heard about the membrane relaxants and other things like that. So no clinical grade, so-called clinical grade standards for defined for any in vitro agents that are not normally used for reproductive embryology, but which may be used in research embryos and in vitro research with eggs. So those standards don't seem to have been defined yet. We also know, just as John just pointed out, that experience matters for these techniques. So you might think of it analogously like microsurgery, and the person doing it has to be really well qualified. You can't just walk in and just do it, right? As I understand it, the people who've tried this in the UK and in the US, they've sort of went from many years in the mouse model and maybe some primate work, and you can't just walk into it. I've heard from one human cloner that SCNT is really hard and it's really boring, and it takes a lot of practice. So anyway, those are issues that obviously relate to defining the risks for first-generation children and possibly, coming up with some way to define the risks for future descendants. Now, what I want to spend the rest of my time speaking to are the ethical and policy issues surrounding preclinical research. Particularly, I'm talking here about in vitro research using human biomaterials. I just want to point out that the FDA, obviously, if you're requiring preclinical research in vitro, I want to point out that the FDA would be requiring in this step research activities that are highly controversial in the U.S. So two research activities. One is research egg donation and use, and the other is research embryo creation and use. Okay, so let me speak to the first issue. Research egg donation, which is different than IVF clinical egg donation. A lot of people, I think, conflate the two. I think there are very important differences. There are egg donation for research guidelines and in some states laws prohibiting compensation for time, effort, and inconvenience for the women who go through this procedure, who will be asked to go through this procedure for research purposes. There are not laws banning compensation, for example, in Massachusetts and in California, for IVF clinic donations. So I do need to point out that the two teams that have done this have compensated their egg donors for research purposes in New York and in Oregon. That work could not have been done, as experience shows, in California and Massachusetts, because experience shows without the offer of some sort of compensation for time, effort, and inconvenience, you will not get egg donors. So if you want egg donors for this research, and I think you will need them, you have to clarify your policies around compensation for research participation. Some have said that this might open up a free market type of frame of mind, or in practice it might devolve into a free market sort of practice. I do want to point out, however, that IRBs are pretty well equipped, I think, to look very carefully at concerns about undue inducement and compensation of healthy research volunteers. If you think that egg donation for research of all types is ethically permissible, not everybody agrees on that. In Israel, you can't do that. You can't donate eggs for research. But if you think that that's ethically permissible, and if you think that normally under research conditions using healthy volunteers, it's appropriate to pay some level of compensation. So we're not talking about embryo egg research, just in general, if your clinical center does that, not everybody agrees with that either. But if you got 1 and 2, then you have number 3, the presumptive reason for compensating egg donors for research. So I think we need to explore that issue further. I do need to point out that NAS guidelines for stem cell research do not recommend compensation beyond direct reimbursements for direct expenses. So maybe there may have to be some sort of cross-dialogue with that group, and just to kind of harmonize your standards so it doesn't appear that that the FDA is requiring research that's, I guess, in principle, or not principle, in practice would sort of go against NAS guidelines for stem cell research. Okay, so anyway, I think IRB is already well equipped to take this on. There's not, maybe they have to sort of get a little bit more guidance about things like the number of times of egg donation that would be appropriate, the exact compensation level. Apparently the egg donors will have to be screened for mitochondrial disease, so you have to add in the element of return of incidental health-related findings or individual research results for people like that. So not impossible, all doable, a little bit of retooling. So the second area that I think is a little bit more problematic, this is going to be more of a regulatory capacity issue that's sort of not just about tweaking the IRB, but maybe setting up a new structure. And that's the issue of research embryos. So as you know, the Wiki-Dicker Amendment prohibits the use of federal funds. I have it right here. No federal funds available for, 1, the creation of a human embryo or embryos for research purposes. That's what we're talking about. Or 2, research in which a human embryo or embryos are destroyed, discarded, or knowingly subjected to risk of injury or death greater than that allowed for research on fetuses in utero under 45 CFR 46. You gotta love Siri. Anyway, so what does that mean? Well, NIH is not gonna fund this. Okay, so whether you're creating embryos in the lab or you're getting IVF embryos and you're manipulating them and you're discarding them, NIH is not going to fund that. So where does the money come from? Look at New York, look at Oregon, where do they get their money? Maybe a combination of state money, private donations, et cetera. The labs where you do this research have to be separate from sort of the NIH-funded labs. So again, no surprise that you're seeing a nice collaboration here between the stem cell research history with funding and what we're going to likely see in the environment here. Other point to point out, look, I mean, creating research embryos is illegal in some countries, right? Canada and Germany, for example. There are embryo research oversight committees in the UK, Australia, and Singapore. UK is the one that I think people have spoken most about. We do have experience with their lack of being such a committee in the US, and we've heard about that from the early 90s yesterday. So what group is going to be retooled to do this kind of research oversight? My guess is right now, currently in the US environment, it would be the Human Embryonic Stem Cell Research Committees would then be repurposed a little bit. Maybe, that's my guess. I'm the chair of a couple of these things. I don't know if I really would be comfortable reviewing this. We would have to be told what exactly are we looking for. This is not, maybe there's a stem cell element to the research, but it's not purely stem cell research alone. So I do want to point out the following problem. We have to, at some point, the embryo committees, whether in the UK, Australia, or Singapore, or the repurposed escrow committees, would have to at some point address the question, is this research important? Is the goal important? Is it justified? Because those are the things that people talk about in the embryo committees in other countries. Here's the problem, though. Look, there are, and I'll illustrate the problem with the following metaphor. How would we address that question? So imagine a highway with 3 lanes. Okay, in the left lane is what I would call the risk-based precautionary approach. Here, the source of uncertainty is just lack temporarily of scientific data. The basis for going forward is just get more data. And given at some point the existing scientific information, however incomplete, we're going to just go ahead and go forward. Regulation is risk-based. Left lane, that's FDA. That's, I think by the nature of the FDA, they are in the left lane. There's the center lane. There's another lane. It's the science is itself limited precautionary approach, which is kind of more of an attitude of just uncertainty is not temporary. It's inescapable. It's an inescapable condition of all science. So the basis for going forward is not simply just scientific knowledge. It will be other inputs and values. And regulation there will look at factors beyond risk. So the question, is the research goal important or justified? It's not going to be solely from the Embryo Committee. It's going to have to happen alongside discussion of risk. So the final lane, this is what I'm going to close with, you got the right lane. And I've heard people here who are definitely in the right lane. The right lane is scientific solutions are inherently dangerous. That's your approach. New technologies are not fully controllable. They're capable of causing unpredictable harms. What's your basis for going forward? Potential for controlling the technologies, reversing harms. On the basis of these kinds of factors, we then choose technologies. And sometimes you might want to just exit the highway at the next opportunity, just exit, right? Is this research important or justified? Well, by the time you get to that question in the Embryo Research Committee, you've already sort of shown your hand and that you think it is important to go forward. So what is the selection criteria for these three lanes? What is the selection criteria? That's an ethical question. It's not a scientific one. And I will end there because I'm out of time.